if you were on or you're taking letrozole or you're thinking of starting letrozole, another really common question I get is what to expect. Like what are some of the side effects? A lot of women I work with are women who have been hesitant in their lives to take medication, and that's okay, right? I think we all have some degree of like, especially when it's hormonal and we hear, you know, we all were on birth control and then we were told it was a horrible thing for us. And now we're just hesitant about anything that has to do with our hormones. So letrozole is something, and if you look it up, I mean, it's a cancer drug, right? So that's also very concerning. It has been widely used in the fertility realm for a very long time. And I would say in the decade that I've done this, from a side effect standpoint, it is something that is fairly well tolerated. I do have some women, I will not lie, that feel absolutely dreadful on letrozole. It happens. Everyone is going to be a little bit different, but typically not a lot of complaints. Biggest ones being headaches, vaginal dryness or lack of egg quality cervical mucus, dizziness, fatigue, mood changes, irritability, anger, sadness, because it's lowering your estrogen, right? So that doesn't feel well for a lot of us, especially to go from good to low. But I would say headaches and vaginal dryness are the top two symptoms that I get complaints about when women are using letrozole. And with the headaches, I will say, like, there's oftentimes not a whole heck of a lot we can do because it's hormonally driven. And that's the really annoying part. You know, we want to stay hydrated. We want to keep our blood sugar balanced. Absolutely take pain management if you need it. Hot and cold contrast therapy, dark rooms, less screens, like all of your headache tools, especially if you are, I find headaches tend to happen in the women who are just more prone to headaches in general. So the women who are prone to headaches, you have like your remedy kit, right? That typically works for you. Use those things, use that scaffolding, but also know that when it's hormonally driven, to fix the root cause, it's to fix the estrogen. And we can't when you're on the letrozole, right? So typically they do go away pretty quickly, but that is one I definitely get, I would say, the most complaints about. And then the vaginal dryness being the one that we do want to focus on when we're having the conversation about, well, how do I support my body? Because we talk so much on the podcast about how important egg quality cervical fluid is to create a healthy environment in the vaginal canal for sperm to survive, to swim, to get to where they need to go. So to dry that up feels very counterintuitive. And I get that. It is very counterintuitive. However, it's an unfortunate trade-off when we are using ovulation induction medication that sometimes we just have to eat. And so sometimes this doesn't happen. Not every single woman ends up with significant vaginal dryness when they're on letrozole. And sometimes it does. So I jump ahead of myself. How do we actually support your body when you are taking letrozole or as you're gearing up to take letrozole? So first things first, I already mentioned this, but you do not want to be doing anything that messes with your estrogen while you're taking it. So typically, rule of thumb, and this will go without saying, for any sort of thing you're putting in your body, is you need to consult your personal healthcare practitioner before you start or take anything to make sure that it is safe for you to be doing. And in this instance, if you are taking herbs, typically that's something we just immediately pull out with our clients because unfortunately we just don't have the safety data, right? We don't have the safety data. Also for me, I'm way more, I'm probably more cautious than most people in the fertility realm, but definitely when pharmaceuticals are getting introduced, I'm extremely cautious for two reasons. One, this is about you, right? Like we want to keep you safe and your body safe. And also, I don't want to anger your prescribing doctor, right? So if I'm like, oh, that herb's fine, you can stay on it, and then it doesn't work, and the doctor's like, well, you shouldn't have been taking that herb, then I'm the one that's going to get flack for that, right? So we don't have safety data. We don't have the research that we need to feel really comfortable with mixing these two things. And so it's just better to not, honestly. And that's the approach I take with many things when it comes to the pharmaceutical aspect of fertility. Is like, if I can't prove with 100% certainty that we are safe, then we are just not going to mix it together. So that's a conversation to definitely have with your current care team.